Did you injure your MCL, your medial collateral ligament? We're going to go today all things regarding MCL, medial collateral ligament. My name is Dr. Marco Lopez, Doctor of Physical Therapy and Certified Strength and Conditioning Specialist and co-founder of the Basketball Doctors. Our goal with the Basketball Doctors is to provide evidence-based information regarding all things basketball, rehab, performance, injury prevention. This is all just for educational purposes, not medical advice. If you need medical advice, send us a message. We're located in Los Angeles or Orange County, or we could work with you virtually. If not, visit your local physician or orthopedist. So let's just jump into the topic about MCL. So the medial collateral ligament, one of the most common ligaments to be sprained or injured when you're playing sports such as basketball, soccer, football, any contact sport as well. So the medial collateral ligament, this is your knee, here's the outside part, this is your inside. The medial collateral ligament goes from this bone here, the femur, to the tibia. It helps provide stability. So a ligament goes from bone to bone and it provides stability in the knee joint. For the medial collateral ligament, it provides stability in the medial side. Normally when you injure the medial collateral ligament, it happens through a valgus force, meaning your knee slightly bent, someone hits you, and it causes that ligament to be stretched out. Or it comes with some ACL injury. Sometimes you tear your ACL, and because when you tear your ACL, your knee kind of comes in, rotates inward, it injures that MCL as well. Another one is a non-contact. Your knee just kind of comes in inward and tears there. Or sometimes it gets torn with the medial meniscus. So the MCL gets torn with a lot of other things too, but it could also happen in isolation. So when we talk about when an MCL gets torn, like I mentioned, you stretch it out. And when we stretch it out, there's different grades of that MCL being stretched out. So there's grade 1, grade 2, grade 3. They're all dependent on how much laxity there is, meaning how much does it move. So after you injure it, we would bend your knee and we provide a stress test where we push on your knee and see how much it moves. If it moves a lot, then we're thinking about grade 3. If it moves not that much, but we see some movement, grade 2. If it doesn't move too much, it's probably a grade 1. Depending on the grade, it is going to dictate your recovery. Most of the time, you don't need surgery for an MCL injury because it has good blood supply. Also, there's several fibers. There's a superior fiber, there's an oblique fiber, so there's different fibers of the MCL. So normally it's hard to really tear everything off of it. However, we have seen an avulsion fracture where this rips off a bone, but not as common. So when you injure that, you probably won't need surgery because it has good blood supply. When you injure that, the most important thing, as we mentioned guys, as you bend your knee, you stretch out that ligament more and more. It's more taut when it's straight. When you injure this ligament, one of the most important things is we want to offload the ligament. So we don't want to have our knee coming inward. So normally they give athletes a brace to offload that ligament, to decrease that valgus force, because we don't want your knee to come in this way if someone hits you or anything when you're walking. So we want to limit that valgus force, and sometimes we also limit the bending early on, because the more we bend, the more we're stretching out the ligament, and we want the ligament to scar up a little bit because it will heal on its own because that's great blood supply. And the way you're going to tell if you tore it, let's say you tore it, you're like, man, I don't know if it's a MCL tear, if not, something else. One, like we mentioned, we do that test. Two, you'll have some local swelling here, some tenderness, and more of that instability. You'll feel like your knee's going to want to give out to the inside because there is that laxity there. So that's why that brace will provide some offset here to prevent the knee from going inward. And like I mentioned guys, depending on the grade will depend on your recovery. Normal MCL injuries take 30 days to recover. However, if it's a grade 3, we're looking at 2 to 4 months. If it's a grade 2, we're looking at 1 to 3 months. Grade 1, you're looking at 2-3 weeks. Most of the time it's a minor grade. That's why you don't see too much surgical procedures with the MCL, because it has great blood supply. So that's kind of a quick little summary of the MCL. Like I mentioned guys, it provides stability in the knee joint on the inside part. Normally it gets injured when someone hits you from the outside, pushing this into valgus, and you'll probably have some symptoms of local pain around here, some tenderness, some swelling, also some instability going inward. But those are some of the main symptoms, but you don't need surgery. Just limit the range of motion early on, then you work on strengthening and getting that stability on the inside part. So hopefully you guys like this video. Hit the like button, subscribe button, share with friends and family. We are the Basketball Doctors. Let's ball for life.